Good morning, everyone, and welcome to ODI. I'm Sara Pantuliano. I'm the Director of the Humanitarian Policy Group here in the Institute, and I'm really delighted to welcome you all to our event today. It's been 10 months since Typhoon Haiyan made landfall in the Philippines, and I am sure everyone who is here in the room and following us online knows very well the devastation that it brought to the Philippines. We're talking of 16 million people affected, more than 6,000 people dead. We're talking of a very, sort of devastating and lasting damage to the economy. More than 33 million coconut trees destroyed for a country that is so reliant on export of coconut oil, and of course, a lasting effect. If you think that it will take 6-7 years for coconut trees to grow again. So we thought it was very important and timely to reflect on the lessons from the response and the current challenges of the recovery phase. And we wanted to make sure that we had the opportunity to make use of the fact that Julie Lynn Hall is with us in the UK. Julie is the representative of the World Health Organization in the Philippines. I'll introduce all the speakers shortly. We're really delighted to have a panel of people who have actually been involved in the response both immediately and in the recovery phase, so they can talk from their direct experience of being involved in responding to the crisis. But just a few sort of housekeeping things before we get started. For all the speakers here, and for you when you take the floor, please speak straight into the microphone. Otherwise, our colleagues who are following online will not be able to hear you. And we have a very large online audience, so we want to make sure that they participate. I welcome the online audience to put their questions through the live chat or through Twitter, and feel free to tweet, all of you. The hashtag is Haiyan, but please do put your phones on silent now. So use them for tweeting, but not for anything else. Should there be a fire, the fire exit is that way, so go that way. There's no fire drill planned, so definitely go that way. And when you put a question to the panel, please introduce yourself and say who you are and if you are affiliated to any institution in particular. Great. Well, let me start by introducing the speakers, and then I'll give the floor to Julie, who will give us a little bit of the background on the situation and the crisis, and frame the discussion for us. So as I said, Julie is the representative of the World Health Organization in the Philippines. Julie was also the acting resident coordinator when Haiyan made landfall in the Philippines, so it was invested with the coordination of the response right away. But her experience in the Philippines actually goes back to when she was 18 and was a volunteer with the Philippine Red Cross. She's worked in a number of countries and responded to diseases such as SARS and H1N1 during her long-standing career with the WHO. She's also served as the principal medical advisor for the Australian government and was the global team leader for polio UNICEF. An impressive career. I'm sure we can learn a lot from you, Julie, today. To my left, we have Justin Dell, who is the recovery program manager at the British Red Cross. Justin has worked for more than 15 years in humanitarian and development programs, and he's been involved in crises in tsunami, Sri Lanka, South Sudan, Uganda, but also typhoons in Bangladesh, Myanmar, and the Philippines itself. Still to my left is Tom Newby, who is the emergency shelter team leader at CARE International. Tom is an engineer by training and has actually worked for a number of NGOs in that capacity, including Engineer Without Borders, and is now a trustee of Engineers Without Borders. But he's also worked with Tear Fund and Habitat for Humanity. Justin and Tom deployed in the Philippines shortly after the crisis, so we hear from that particular experience as well. And then, last but not least, to my right, Michael von Bertele, who is Humanitarian Director at Save the Children International. Michael is a senior medical leader. He has a lot of experience that spans organizations such as Peaker Institute, but also the UK Ministry of Defence. And in fact, from 2009 to 2012, he was the Director General of the Army Medical Services. So an impressive panel to guide our discussions today. Without further ado, I'd like to give the floor to Julie, who can again introduce the discussion, giving us a bit of a background, and then I'll start posing questions to the panel and then open up the discussion to the audience here and online. Julie, the floor is yours.